Okay, welcome back. This is my story about how I survived brain surgery. Very, very quick recap if you're new here. I was diagnosed with a brain tumor by my gynecologist in March of 2023. In April, I saw the endocrinologist at Johns Hopkins, decided to have surgery in lieu of medication. August of 23, I met with my neurosurgeon, discussed the surgery in detail, everything about it. September of 23, I met with my ENT to do a nasal exam because my surgery was through my nose. And then end of October and into beginning of November, I did my final MRIs, CT scans, and met with the anesthesia team. November 15th, it was a Wednesday, I had brain surgery. So now we are at the point of me waking up in ICU. Now, when I woke up, I could only have 2 visitors at a time. So my brother and his girlfriend were the first 2 in there. And I remember, coming out of it and I could hear him calling my name. And then when I opened my eyes, he was standing there, recognized him immediately. So I felt good about that. And the first thing I thought about was that question that I had mentioned at the end of the previous video. And that question was, I called my brother, his name is Marcus. I was like, Mark, come here. And I'm being real dramatic, but this is really how I was coming up. And I was like, come here. And he was like, yeah, are you good? Do you need anything? And I was like, tell me, do I look smarter? And he was like, no, you look the same. And I was like, I don't look smarter? And I think he thought something was wrong with me. So he was like, doc? But that was my question. My question was, do I look smarter? Of course, they're not going to make you smarter with brain surgery, but it was a nice way for me to wake up, for my family's sake. So they were there with me for a little while, and I had asked him prior to surgery to document this process as much as possible. I'm one of those people who want to remember something like this. I said, take pictures, take videos. I don't care how bad I look. If it's embarrassing later, I'll delete it, but document this process for me. So luckily, he took pictures for me. He took some videos, and I'll probably create some kind of a slideshow or something of those, on here. But yeah, so he was with me for a little while. Then they left, and my parents came in. I asked them the same question, but I found out later that when he went to let them in, he told them, he was like, she asked me if she looked smarter. And I think that kind of worried them. And I'm like, you weren't supposed to say anything. But anyway, so they came in, I was talking to them. And the process when you first are coming out of it is every hour on the hour for like either 6 or 12 hours, I can't remember now, but they do a neurological test on you. And that entailed them asking me the same 4 questions. The first one was, what is your name? What is today's date? Where are you? And why are you here? Every time they asked me those same 4 questions. And then for the rest of the neurological checks, they put a flashlight in your eye, make sure your pupils are dilating. They ask you to lift your eyebrows, stick your tongue out, move your tongue side to side, shrug your shoulders. You squeeze their fingers, pull them to you, push them away from you, and then you have to lift your leg and resist them pushing your leg down. Now, did that the first time, I was able to answer all the questions. Your brain is moving a little bit slower, but I was able to answer the questions. But when you're coming out of anesthesia, you don't really have a concept of time because you're kind of in and out, sleep and wake up. And so they asked that first set of questions and stuff, and I guess I dozed off because it seemed like 2 seconds later, they're right back in my face asking me the same questions. And I remember at one point getting a little annoyed, I guess, because I'm like, you just asked me this. Why do you keep asking me these questions? And again, in the moment, you're not processing things how you normally would. So I had to realize, and I think they explained this to me, that for some people, when they come out of this surgery, answering those questions is difficult. They might have to sit there and think, what is my name? Today's date is, and it takes a minute. And so that was very humbling for me to realize that some people can't do it or struggle with it. And, then my attitude changed, and I was very grateful, to be able to answer the questions and everything. So let's talk a little bit about unexpected things that happened or that I was experiencing after the surgery. The first thing, and these are in no particular order, but just as I remember them, I remember at one point touching my head, and I had these cuts in my head. And I started to freak out because I thought something happened where they couldn't go through my nose, and they ended up doing a craniotomy. So I asked the doctor, and I was like, what happened to my head? Like, there's these cuts and stuff. And he said, oh, that's just where the clamp was. We did go through your nose. And I was like, what clamp? I'm sure this was in the fine print somewhere, but leading up to surgery, you don't remember everything they tell you. Your brain, you're just so nervous about everything. You don't hear half of what your surgeon probably tells you. You're just like, okay. So when you have brain surgery, your head is going to be in some type of clamp. Now, mine was called a Mayfield skull clamp. Basically, there were 2 prongs on this side, 1 prong on this side, and it connected over, and then they attach it to the operating table. And what they do is wind it up, and it puts pressure on your skull. So for 8 hours, there was 60 pounds of pressure being pushed in on my skull. And those prongs that attach to your head are sharp. They're not like knife sharp, but they're very pointy. So as they're winding it up and it's pushing in, the prongs like pierced my scalp, not my skull, but my scalp. And so what I was feeling afterwards was basically dried blood. And it was so painful. And then the bottom prong attached like somewhere above my ear. And what I found out later is you have a jaw muscle that kind of comes up the side of your face, and it connects somewhere above the ear. So for 8 hours, that bottom prong was pushing in on that jaw muscle. So the whole left side of my face was burning, throbbing, just, I couldn't open my mouth, just regular talking. I could open my mouth like this much. Past that, it was incredibly painful. I couldn't chew, none of that. Not that you're really hungry after surgery, but so that was one thing. The other thing is when they do this operation, I explained before, they go through your nose, they drill through 2 bones in your skull to get to the tumor. Now, once they drill through those bones, there are holes right there. And silly of me, I thought the bone regrew, but my surgeon told me, I know he's probably like, you poor thing, your bones don't regrow. So when you're an adult, the bones you have are the bones you have. Typically what happens is scar tissue will develop, and that's how you heal. So for me, imagine there's a hole right here, and this is my skull. They put a synthetic graft over that hole, and that was to kind of like create a barrier so that nothing could pass through and get into my brain. And over time, scar tissue would develop around the whole thing and kind of solidify it. And so the graft is in my face. It'll be in there the rest of my life, but the scar tissue is never as strong as the original bone. So you have a few restrictions moving forward in life. To me, it's not a big deal, but they put that graft there. And then I had 3 inches of dissolvable packing from the base of my skull coming down my nasal cavity. Now with that, you can't feel it. It's not like if you take some Kleenex and like try to put it up your nose and you feel it. It's so far deep in your face, in your head, that you can't feel it. But when you come out of this surgery, they basically destroy your sinus cavities. So you feel like you have a really, really bad cold or the flu in terms of nasal congestion and chest congestion. But because they just drilled through your bones and this graft is just kind of sitting there right now, you absolutely cannot cough, sneeze, or blow your nose for months. I remember the first time I sneezed comfortably after that was probably March or April, and I had surgery in November. So you might be asking, well, how do you stop yourself from doing it? Oh, you figure a way. Because if I were to sneeze and blow out that packing and blow out that graft, what would happen would be I would have a brain fluid leak. It's called a CSF, cerebral spinal fluid leak. It would come out of my nose and I would inadvertently swallow some of it, and that would lead to me having a brain infection, which if an infection gets bad enough, it can kill you. So in my mind, sneezing equaled death. You might say it's dramatic. You might say, oh, it's not that serious. Yes, it is. So once somebody told me that if you feel a sneeze coming on, if you push right here, I guess there's a nerve above your lip, but if you push really hard right here, it'll make the sneeze go away. I was doing that religiously. So luckily I didn't sneeze. I coughed a few times in the hospital. There were some times where I couldn't help it, and then it freaked me out. And I'm just like, is my brain about to fall out because I coughed, you know? So I'm trying to keep these videos around 10 minutes or so. So let's end right there. We'll pick back up with more of the hospital stay in the next episode, or in the next part of this story.